If myeloma is a cancer of the immune system, does immunotherapy risk making myeloma worse?
That's exactly the problem. So, I mean, a myeloma cell is an immune cell. You have to figure out how to balance these things, which is, I think, a very different scenario than what you see in a solid tumor, where the cancer cell itself is not part of the immune system. And so it's a much cleaner system to block than you would expect to see in many of the blood disorders, such as myeloma.
It sort of makes intuitive sense when you're talking about a cancer of the immune system that supercharging the immune system may not be the best idea. Classic immunotherapy that most people are familiar with because they see the commercials for things like Keytruda, that hasn't been as successful in myeloma. It actually increased death. When paired with IMiDs, it hasn't been as successful. The FDA shut all those trials down appropriately because we were seeing an increased risk of infection, which was unfortunately in some patients a very severe infection. We are just now reinvestigating some of these therapies in myeloma, being very cautious, of course. I think we saw some of the downstream effects of that with it was pembrolizumab plus lenalidomide plus dexamethasone and pembrolizumab plus pomalidomide plus dexamethasone trials.
One of the exciting things about the current immunotherapies in multiple myeloma is that they are so targeted. There are immune therapies that are being used in other types of cancer, medicines that just activate the immune system or cut the brakes on immune cells like T cells. And those immunotherapy treatments that are non-specific and non-targeted do have the potential to cause immune-related side effects where the immune system starts attacking other parts of the body. But the immunotherapies that we're developing in multiple myeloma right now, the vast majority of them are very targeted. They involve aiming the immune system against a specific protein that's on the outside of cells, and we're picking protein targets that are specific to myeloma cells so that they're either only on myeloma cells or on myeloma cells at a much higher level than they are on any other cell in the body, so that when we aim the immune system at them, we're really just killing the multiple myeloma cells and leaving the rest of the body alone.